Now, in terms of the anatomy of your heart is about the size of your fist, weighs less than a pound. We find it in the ventral body cavity. Okay, remember, ventral means front. A little more specifically, we could say it's in the thoracic cavity. That's the cavity that sits essentially above the diaphragm. More specifically, we could say it's in the mediastinum, which is sort of in the middle under the sternum. Or most specifically, we could say it's in the pericardial cavity. Okay, so that's just sort of a recap on anatomy 1, going through those cavities, those body cavities. It does sit right above the diaphragm, and it sits slightly left of center. You can remember that because, when you say the Pledge of Allegiance, you use your right hand to put it over your heart. And when you do that, it's just a little left of center. It sits in front of the vertebral column and behind the sternum. Now, one thing I do want to point out is that we say these terms base. Here, let me go back. Sorry, I went forward too quickly. Base and apex. So the base of the heart is actually at the top of the heart. So it's here, and it's where the heart is. I just remember it's flatter. The apex of the heart is the pointy part of the heart at the bottom. Okay, and I know that's sort of a little backwards from the way you're used to thinking. So just remember the apex is always the pointy part of the heart. Okay, so again, if you draw out a heart shape, right, this at the bottom where it's nice and pointy would be the apex, and at the top where it's nice and flat would be the base. Now, I want to walk you through, in terms of heart anatomy, let's talk a little bit about the coverings of the heart. So we call the pericardium, it is a double-walled sac that encloses the heart. Now, the pericardium has sort of 2 parts to it. In reality, it's kind of 3, but the 2 big parts, I'm going to number them here. On the very outside is something called the fibrous pericardium. And when I see that word fibrous, I think fibrous tissue. I think lots of collagen fibers, lots of reticular fibers. This is going to be a tough tissue. And it is. It is thick. It's very tough. And so its function is protect. It's going to protect the heart. It's going to anchor the heart to surrounding structures. The other thing it's going to do is it's going to prevent the heart, because it's so thick on the outside, it actually prevents the heart from swelling and overfilling. So you can kind of think of it as like the Spanx for the heart. It's kind of holding everything in. So I'm going to skip forward and show you a picture of this fibrous pericardium. So if you look at this image at the very top here, you can see that we're just taking a little section right here and blowing it up really big so we can see the layers on the outside of the heart. And so what we can see here is this right here in red. This is the heart muscle. So that's the wall of the heart. So we're looking on the outside of that. So we're looking at the stuff above that. Okay. So let me erase that. So this part right here, that's the fibrous pericardium. So the fibrous pericardium, you can see it's thick. And then I really like here, sort of at the edge, they're trying to show you all those fibers in there. Remember, collagen fibers are stronger than steel. So this is a fiber that is so strong. And so it is providing a fabulous protection on the outside of the heart. Now let's go back. Underneath the fibrous pericardium, we have what's called the serous pericardium. Now, that should sound familiar to you. Serous pericardium. We talked about serous membranes in Anatomy 1 and how you have serous membranes around the lungs and around the heart and around the abdominal pelvic organs. But remember, your serous membranes are 2 layers. You have 2 layers of serous membranes separated by a fluid in between. So this is why I said a few minutes ago that the coverings of the heart, I have listed up here on the screen that there's 2, but it's kind of 3 because your serous membranes, there's 2 membranes in there. Now, remember, when we talk about serous membranes, we give them the first name always tells you sort of where it is around that organ. So if it's the parietal pericardium, that means that it's on the outside, way on the outside, sort of against the cavity itself, the cavity wall. The visceral pericardium, visceral means organ, okay? And so the visceral pericardium is actually going to be sitting on the heart itself. And these two are separated by some fluid. So let's go to this picture now. I'm going to erase what I drew up here. Okay, so we talked about the fibrous pericardium. Let's talk about these serous membranes, the serous membranes around the heart. So I like the images on the bottom because it really depicts what those serous membranes look like. So you can see the image over here on the right side of your screen. You can see that someone's taken their fist and they put it into this balloon here. And so what we end up having is the part of the balloon that's actually touching the fist. So this part right here, that would be called the visceral serosa. It's touching that particular organ. And then on the outside out here, this would be the parietal serosa. It's farther away. It's lining that cavity. And you can see that in between the two, there is some fluid. So now let's look at the side on the left where you actually have the heart. So again, where it's actually touching the heart itself is the visceral pericardium. And around the outside is called the parietal pericardium. So those terms are really important. Again, visceral means organ. It's going to touch the organ. And parietal means cavity. It's farther outside. And then you can see in between the two is fluid in there. And we call that space the pericardial cavity. Now, a lot of your organs in the ventral body cavity have serous membranes, these double layers of serous membranes around them. And the reason for that is you don't have empty space in your body. So you think about the very active moving organs inside your body, the heart, the lungs, all of your digestive tract. These are organs that are constantly moving. What you don't want is for a very active organ that's constantly moving, you don't want it to be rubbing on a neighboring structure or organ because it would create friction. And just like when you rub your hands together and you generate friction, you generate heat. Heat causes swelling and inflammation, and that leads to pain. So we don't want that. So around a lot of these organs in our ventral cavity, we have these double layer serous membranes with fluid in between, so that as the organs move, there's no friction. There's no friction, there's no heat, there's no pain. So that's the whole function of these serous membranes. And again, we talked about that in Anatomy 1. Now let's go back to the image at the top, and we can see here, right next to that heart muscle, which again, this is the heart muscle, that is going to be the visceral pericardium. So there's our visceral pericardium. And then farther away, just underneath that fibrous pericardium, we have our parietal pericardium. Okay, so those are the two serous layers, those serous membranes, the visceral and parietal. Okay, and again, these are going to sit just under that outermost layer, which is the fibrous pericardium. And separating the two is a fluid-filled space called the pericardial cavity. Now, there is a condition called pericarditis. This is inflammation of the pericardium, and it causes those serous membranes. So it causes the visceral pericardium and the parietal pericardium to swell up. And if they're swollen, they start to stick to each other. So every time the heart contracts, those membranes rub on each other. This can actually be heard with a stethoscope. It's a creaking sound. We can actually hear a lot of things when we listen to the heart. So we can hear different sounds that might be abnormal, like a whooshing sound might indicate a heart murmur. We'll talk more about that later. But a creaking sound indicates pericarditis. Remember, itis is inflammation of. And so if these serous membranes, the visceral and the parietal pericardium, are sticking together, it can cause pain, but it can also interfere with heart activity. So the heart's not able to pump the blood as it should. In severe cases, what can happen is a condition called cardiac tamponade. And this is going to cause excess fluid to start to accumulate because of the inflammation. And the fluid has nowhere to go, but it's going to start to push on the heart itself. So you can see the image down at the bottom. You can see that fluid pushing on the heart, and it really compresses the heart, limiting its ability to fill up with blood and pump blood where it needs to go. So this would get treated by draining the excess fluid. Now, continuing on with the anatomy of the heart, let's talk about the layers of the heart wall. So when we look at the heart itself, there are 3 layers. There is something called the epicardium. Remember, epi means above or on top, right? Think epidermis. This is basically the visceral pericardium. So let me go back to this picture. Okay, so the visceral pericardium, which you can see right here, okay, that is also called the epicardium because it sits above or on top the heart muscle itself. Okay, and so you can see that it's given the name here as well. So the visceral pericardium is the same thing as the epicardium. Okay, so that's the top layer. We also have the myocardium. Now you should know that prefix myo, mice, or sarco means muscle. And the myocardium, the heart muscle itself, is actually arranged in bundles. So all those muscle cells, they're all linked together so that they can contract as a unit so that your heart can actually pump the blood effectively. And they're arranged in bundles so that the electrical current can run correctly through the heart. Now, there is also a fibrous tissue that the heart muscle will connect to. And I think of it as almost like the scaffolding for the heart. It's anchoring your heart muscle cells. It is supporting the heart. It's preventing it from overfilling. And it's also, again, making sure that action potentials are moving the correct way through the correct pathway in the heart. And then lastly, deep on the inside, we have the endocardium. So this is, endo means inside. And so this is going to be the innermost layer. It's going to line all of the chambers of the heart. So the atria, the receiving chambers, and the ventricles, the pumping chambers. It's also going to line some of those large vessels that enter and leave the heart. That's called the endocardium. Now, this image here is just trying to show you the heart muscle cells. So the myocardium, it's sort of showing you over here on the right how they are arranged in bundles. Again, they're arranged in bundles so that the heart can contract in unison. Now, the way the heart actually contracts is the atria contract first, then the ventricles contract. So both right and left atria squeeze, then the ventricles squeeze. Right and left atria, and then ventricles. So it really contracts top, then bottom, top, then bottom. And so having these muscle bundles helps with that. Now the image over here on the left, this image, this is actually called the ghost heart. This is that fibrous skeleton that the muscle cells are connected to. This is the scaffolding. So let me go back. Remember right here, we were talking about this fibrous tissue. So here's this fibrous skeleton. What they've done to get this is a pig heart. What they've done is they've taken a pig heart and they've basically washed all the muscle cells off of it. So you can see there's no red on here. So there's no blood. And there's actually nothing here that would cause any kind of immune reaction. This is just sort of a scaffolding that's left over. And the coolest part about this is that they can regenerate this scaffolding using stem cells from a patient and create a heart that is an identical match for a patient. So there is a lot of research being done on these ghost hearts because this could be very promising for people who have to have a heart transplant. They can actually use their own stem cells, so there's very little chance of rejection. Continuing on with anatomy, I mentioned that there are 4 chambers. There are 2 atria at the top, superior atria, and then there's 2 ventricles down below. Now I want to show you some other things that we'll find within the heart. Okay, so one of them, let's look at the ventricles. Okay, so again, here are our ventricles. These are the ones below. These are the pumping chambers. Notice in between the ventricles, we have this structure right here, and it's truly separating the right and the left ventricle. That's its job. And that, let's go back, is called the interventricular septum. So let's break the word down. Inter means between, and septum. When I think of the word septum, I always think of like a deviated septum, right? Which is that tissue that separates the right and left side of your nasal cavity. And so a septum is truly that. It is a tissue that separates open spaces. Remember, you have in your brain, you have something called the septum pellucidum that separates those ventricles in the brain. So the interventricular septum is a tissue that's separating those two spaces, those two ventricles in the heart. Now, if we look at the atria, we also have a septum in the atria that separates the right and left atrium. We call that the interatrial septum. And then we also have something called the fossa ovalis. The fossa ovalis is a remnant that's left over from a hole in the interatrial septum called the foramen ovale, and this is something we find in the fetal heart. So let's talk about this a little bit more. Okay, so this image, we can't really see the interatrial septum very well. We know here's our atria. The septum is going to be behind these large vessels here, so it would be back in here. So we really can't see it from this image very well. Okay. Now we do have in the fetus, there is, when a fetus is in the womb, there is a hole in this septum called, like I mentioned over here, the foramen ovale. And this hole is there because if you think about a fetus in utero, it isn't breathing oxygen from the atmosphere. It's getting oxygen from the maternal bloodstream. So I want to go back to this whiteboard that we did here. So this is what our circulation looks like in an adult, right? Well, in a fetus, if they're not breathing in atmospheric oxygen, we really can bypass this pulmonary circuit up here. So there really is no need to pump the blood out to the lungs and bring it back into that left atrium, because that fetus isn't breathing, right? It's getting the oxygen from mom. And so in order to bypass this, there basically is a hole right here in that interatrial septum called the foramen ovale that is going to shunt the blood from the right atrium right over into the left atrium. And then it'll come down to the left ventricle and out to the body. Okay, and it'll do it again. It'll shunt into the left atrium, left ventricle, to the body, and then back again into the right atrium. And so in this way, in the fetal blood circulation, we're really bypassing that pulmonary circuit. So that is the reason for that foramen ovale. Now, when a baby is born, first thing they have to do is inflate the bronchial tree. So that first breath they take requires a tremendous amount of energy. And it's probably one of the hardest things that they have to do in the first few minutes of life, is to take that breath. As soon as they take that breath and inflate the bronchial tree, this foramen ovale will seal over and they will start having this adult circulation. So that foramen ovale seals over and they'll go back into this adult circulation that we find for the rest of their lives. Now, when that foramen ovale seals over, we are left with a little remnant. Looks like a little divot that's left in there, and that's called the fossa ovalis. So let me go to back to this screen. Now we can actually see, let me erase this so you can see it better. You can actually see the little divot right here. That is that remnant left over. That's our fossa ovalis. Okay. So as an adult, we'll have that little remnant left over from that hole that we had when we were in utero. Now you may have heard of a baby being born with a hole in their heart. That can refer to different things, but traditionally it is when the foramen ovale doesn't completely seal over and there's a little hole that's left. Now, chances are their body will eventually seal that hole, but depending on how big it is, that may require surgery. Now, I also want to walk you through some of the chambers that we'll find and the great vessels that we find associated with the heart itself. So we have something called the coronary sulcus. Now, you have heard of the term sulcus before when we talked about the brain. Remember, we have gyri and sulci. A gyrus is a ridge, a sulcus is a groove. So the coronary sulcus is a groove that we can find on the outside of the heart between the atria and ventricles. So if we look at this image, we can see the coronary sulcus right in here. This is where we would find our right atrium is underneath this area. This is the wall of the right atrium, basically. And then the right ventricle is over here. This is, again, the wall of the right ventricle. If we cut this open, we'd see those chambers. And the sulcus is just the groove on the outside of the heart in between where the atria and the ventricle would be found. And traditionally, in a lot of these areas, we're going to find a lot of vessels. Okay, so there's the coronary sulcus. We also have what's called an anterior interventricular sulcus. So look at the name. Anterior means front of the heart. Interventricular, inter means between the ventricles, and sulcus means groove. So now we're looking for a groove that we find in the front of the heart that kind of separates the two ventricles. Okay, so we have our right ventricle here, and our left ventricle is here. So right here would be the anterior interventricular sulcus. And again, like I mentioned, in a lot of the sulci, we're going to find vessels. And then we also have a posterior interventricular sulcus. And in this case, remember, posterior means in the back or behind. And I don't think I have an image of that one, but if we turn the heart around, you're going to see a little groove in between the right and left ventricle. Now, I want to spend a little more time talking about what we would find inside the chambers of the heart. So some of the anatomy inside those chambers. So we're going to start with our atria. Remember, these are on the top. These are superior. We have a right and a left atria. And then we'll go through our ventricles. So with the atria, first off, if we look at the outside of the heart, on the very outside of the heart where the atria would be, there is something called auricles. And the term auricle means little ear. So I'm going to come back to this picture. Let's erase some of this. And what I want you to see is, again, remember, this is our right atrium. This part right here, that's the auricle. It's kind of hard to tell from this picture, but it almost looks like an earlobe. It's like a little flap that we see on the outside of the heart, right there at the atrium. And the job is that it actually increases the surface area so that the atria can fill up a little bit more. Okay, so the volume of the atria can be larger because of that auricle. Now, the right atrium, if we look at the one on the right side, which again, that's this one over here. So if we look inside at the right atrium, what we're going to find is that inside the atrium, it is very smooth on the back, but we'll find some muscle bundles in the front called pectinate muscles. And the term pectin means comb. So pectinate muscles, when you look at them in the front wall of the atrium on the inside, it almost looks like if you've ever had like a pick or a wide tooth comb, it looks like it kind of looks like those ridges. So let me show you a picture here. This is a really weird picture because of the way the heart's been cut. But I will tell you that we are looking right here. This is the right, this is the right atrium. And it's kind of been cut down around the bottom, and then that flap has been lifted up. And so you can see it, the back wall of the right atrium is nice and smooth, but now you'll see the front wall of the atrium. Again, if we lay this down, it'd be in the front. The front wall, you can see those pectinate muscles. Again, it kind of reminds me of like a pick or a wide tooth comb. Now, there's also a ridge between the front and the back on the inside of the atrium called the crista terminalis. And you can see that here is that ridge, that crista terminalis. And that's just sort of a ridge between the anterior wall and the posterior wall of the atrium on the inside. Now, the left atrium does have some pectinate muscles. We would find them only in the auricles, so only on the inside where those little flaps are. And then we can also see that fossa ovalis. So we can see the remnant of the foramen ovale, that hole in the fetal heart. Now remember, the term atria means entryway. So I just remember, like, I think of, like, you know, when you walk into the atrium of a house. I mean, my house isn't big enough for me to call it an atrium. People would think I'm crazy. I don't have a billiard room or a conservatory. But, you know, when people have really fancy houses, they have an atrium that they walk into, and it means entryway. And so this is why they get the name atria. These are the receiving chambers. So again, if we come back to our whiteboard, so remember, the blood that's coming into the heart, notice it is always coming into our atria. Now the atria are small, and they also have really thin walls around them. They don't have a ton of muscle in the wall of the atria. And the reason for that is they really don't contribute a lot to the propulsion of blood, because I want you to think about where the blood is moving in the heart. It's coming into the atria, and then from the atria, it's going to move down into the ventricles, which are the pumping chambers, and the ventricles are going to pump that blood out where it needs to go, either to the lungs or to the body. So the atria really are only sending the blood from the atria down to the ventricles, not very far. So this is what we mean when we say that it contributes very little to the propulsion of blood. Now, I do want to talk a little bit about the atria, and I told you that the blood is coming into the atria. Let's talk about the vessels that are bringing the blood into the atria, into the right and left atria, okay? So we're going to start with the right atrium over here, okay? So now remember, I want you to think back to the little drawing. Remember, the right atrium is getting the blue blood, so that oxygen poor blood from your body's tissues. Okay, so there are 3 vessels that are going to dump into the right atrium, right? Now, you should already know that they're blue in color because it's taking that oxygen poor blood. Remember, the whole right side of the heart is taking oxygen poor blood. The left side of the heart has the oxygen rich blood. So the right atrium, there are 3 vessels dumping into the right atrium. So the first one is here. Okay, this is the superior vena cava. Now it gets the term superior because it's above the heart. Vena means vein, and veins get their name because a vein always brings blood toward, the heart. Okay, so veins are always bringing blood towards the heart. So all of these vessels that we're about to talk about that dump into the atria are veins. Okay, so we have a superior vena cava. It's going to be taking all the spent blood from above the heart and dumping it into the right atrium. So that means it's going to be bringing blood from your shoulders and your arms and your head, and all of that is going to drain down into the right atrium. We have an inferior vena cava. And the inferior vena cava is basically taking all the blood from below the heart and draining it back into the right atrium. So it's going to be draining like your legs and your body's trunk. Okay, so we've done these 2. Superior vena cava, everything above the heart. Inferior vena cava is draining everything below the heart. Now I want you to look at this third one, the coronary sinus. We've already drained your body. We've drained everything above the heart and everything below the heart. So what on earth would the coronary sinus be draining? It's draining the heart muscle itself. So remember, your heart is a muscular pump, and it is contributing to the propulsion of blood throughout your whole body. But the muscle itself has to have oxygen, and those cells in there are going through reaction. So they're creating waste, they're creating CO2. So we have to drain the spent blood from the heart muscle itself. So I want you to now look at this heart, and I want you to now, you probably haven't realized it yet. We've talked a little bit about the vessels, but now I want you to really see on top of the heart, look at all these vessels on top of the heart, right? These are supplying the heart muscle itself. So we would say that the coronary sinus is draining the heart muscle itself. And so here is the coronary sinus. It's actually on the back side of the heart. So all the spent blood from the heart is moving into the coronary sinus and dumping over here into that right atrium. Okay. Now let's look at the left atrium. Okay, so now we're looking over here at the left atrium. Okay, and there are 4 vessels that drain the blood and put it into the left atrium. So now again, remember though, the left side of the heart is getting oxygen rich blood. And in this case, remember that what's coming into the left atrium is from the pulmonary circuit. So it's that nice oxygen rich blood from the lungs coming into the left atrium. And so these 4 vessels, 2 are on the right and 2 are on the left. 2 are coming from the right lung and 2 are coming from the left lung. So they're bringing that nice oxygen rich blood back to the heart. And so we call these, you can see there's 2 here and 2 here. The other 2 are over here. Now I know it kind of looks like they're going in the other side, but if we turn the heart around, so look at it from this angle, you can see those same vessels right here. Okay, 2 from the right and 2 from the left there, the lungs. And these are called pulmonary veins. I said vein. They are red in color, but remember how we name a vein? It's veins because they are bringing blood toward the heart. So the vessels that are draining into the atria, into those receiving chambers, those are all veins because they're bringing the blood to the heart, towards that heart circulation. Now let's walk through our ventricles. Okay, so the term ventricle, ventri means underside. So these are inferior, they sit below the atria. These contribute to most of the volume of the heart. So these fill up with a lot more blood than the atria do. We have a right and a left ventricle. Now, the way the heart actually sits in the body is it actually sits a little diagonal, but then it also sits a little cattywampus. So we say that the right ventricle is more in front and the left ventricle sits a little more behind. Now, if we look inside the ventricles, we're going to see these sort of irregular ridges of heart muscle, and they're called trabeculae carnae. So let me show you a picture of these. This right here is trabeculae carnae. To me, it looks like when we look at it on a preserved specimen, it looks almost like, remember Nightmare on Elm Street, Freddy Krueger? It looks like Freddy Krueger's skin. And so that's how I remember the trabeculae carnae. I've had other students tell me they remember because they think of carne asada, and like carne means meat. So trabeculae carnae, it's just the muscle, it's the meaty part that's it's just sort of grooved in those ventricles. Now, another thing that we'll find in our ventricles are something called papillary muscles. Now, that term papilla should look familiar. We talked about dermal papillae in Anatomy 1. And remember, the dermal papillae are these finger-like projections that stick up from the dermis and connect to the epidermis and hold those 2 layers of your skin together. So papillary muscle literally looks like finger-like projections. That's what papillary means. And so let me show you an image. Here is a papillary muscle, and here is a papillary muscle, and here is one. So you can see they look like these little finger-like projections sticking up. And they're actually anchoring these white structures here. And these white structures look like little strings. Those are called chordae tendineae. Okay, chordae tendineae. and the chordae tendineae are attached to the heart valves, which we'll talk about in just a little bit. So you can see those white valves. So the papillary muscles play a really large role in helping to open and close a heart valve, which is sort of like a door. Now, another thing I want to mention about ventricles is that they have a much thicker wall than the atria. So the muscular wall around a ventricle is much thicker because remember, ventricles are the pumping chambers. So they have to have more muscle. They've got to pump the blood out. They're either pumping it out to the lungs or pumping it out to the rest of the body. So the right ventricle is going to pump blood out to the lungs through a vessel called the pulmonary trunk. Now, we also call this the pulmonary artery. Now, arteries get their name. I always remember the A in artery for the A in away. They are carrying blood away from the heart. So the right ventricle is going to pump blood out through the pulmonary artery to get out to the lungs. Okay, so let's look at this picture. Let me erase some of the drawing on here. Okay, so here is our right ventricle. When it squeezes, it's going to pump the blood out through that vessel right there, which again is called the pulmonary artery. Okay, pulmonary artery. Now we can also call it the pulmonary trunk. I think it's helpful to remember pulmonary artery because you remember artery away, and this is going to send the blood out to the lungs. The left ventricle is going to pump the blood out to the aorta. And the aorta is actually the largest artery in the body. So here's our left ventricle. And this one's kind of hard to see because the aorta, which is this red vessel here, it sits behind the pulmonary artery. And so when the left ventricle squeezes and contracts, the blood is going to move up into that aorta. And it's going to feed your body's tissues.